What I'm doing here is these exercises for your wrist. These exercises are designed for wrist pain and forearm pain, for tenosynovitis, tendonitis, and other inflammation of your tendons and joints in your hand and your wrist and your elbow, all the way up to your shoulder. The first one that I'm doing right here, I'm just opening and closing my hand really, really slow. The slower, the better. And what it's doing is stretching and bringing attention to the tiny little muscles in these knuckles and joints. The slower you can do it, the better. You only need to do each exercise for about 1 minute. I'm probably even going a little bit too fast. If you can do these slowly, it's a good start. The second exercise is you put the pressure here and you continue opening and closing your hand. Moving the joints really slowly allows them to get a more focused stretch. When you move the joints fast, it kind of overrides the tiny little muscles that are in your hand. They don't actually get a proper stretch. This works really well. So I've opened and closed my hand once, having the pressure. My left arm is putting pressure on my right arm, and now I'm going to take this arm off, move it just a little bit along towards the hand, and apply pressure again. And then open and close your hand quite slowly. If you look at your wrist while you're doing this exercise, you can actually see your wrist tendons moving each time you open and close your hand. You just open and close your hand once or twice, and then you move your other arm closer to your hand. Each time you overlap just slightly where your arm was sitting before, where you were applying pressure. As you move your left forearm closer towards your right hand, you'll feel the pressure increasing. This particular exercise takes probably more than a minute, as long as it takes for you to work all the way down to your wrist with your left forearm putting pressure on your right forearm. It takes a little bit of patience, but you really do feel the benefits of this exercise all the way through. If you're doing this exercise right now, you'll be able to feel it. Each time you move your forearm down, be able to feel the blood flowing through your hand, through your arm into your hand. How much much pressure you put is mainly up to you. You don't want to put so much pressure that you can't open and close your hand, but you do want to put enough pressure that it creates some friction for your hand to stretch out underneath of. There's got to be a bit of a hold there so that when you open and close your hand, it actually stretches each tendon that goes to your finger and goes all the way up. I'm nearly finished. The very first time I did this, by the time I got to my wrist, it was really sore. It was exploding. But in your hand, you have tendons that go through each finger. They all pass through your wrist, and then they all go up and connect here in your elbow. So the second exercise is we're gonna go this way. It's not really important what order you do them in, but we're gonna do them in this order. My hand's a bit sore from being like that, so I'm gonna do the next one like this. And likewise on the inside of your hand, on the top of your hand, you've also got muscles and tendons that go from each finger through your wrist and run up your forearm and connect in here. And you've also got a couple of muscles in there, but that's not really what we're focused on. This is an exercise designed to lengthen and stretch and strengthen the tendons in your wrist that connect to your elbow from your fingers. And this will help to create space in the joint there and actually alleviates the inflammation. So this is one of the exercises you only have to do for about a minute. And again, the slower the better. So you just put your hand down like that. It's got to be horizontal, and you just put your hand down and then back up to horizontal. And this might seem like a really simple thing to be doing, or what is this going to do? But it really, really does work. And when you do this in conjunction with all of the other exercises I'm about to show you, you'll find that it actually does create quite a lot of relief in your wrist and your arm and even your shoulder. Again, the slower you do this, the better. I have a clock just here. If you have a clock that you can see while you do this, that's a really good way to do it, so that you can time how long you do each exercise for. Only about a minute. The second exercise I'm going to do is very similar, but we just go up like that. And stop at horizontal and bring your hand up. This is lengthening and stretching the tendons underneath your wrist, and it's strengthening and stretching the tendons on top of your wrist. I'm using a massage table, but you can use a chair. I've also heard some feedback from people that they say they're more comfortable just using the floor, although I'm not sure how you would use the floor for the downward motion ones, because you really need a space there for you to bring your hand down, but that's too fast. If you do it faster, you'll notice clicking in your wrist, so that's why it's quite important to go very, very slowly, so that each little fiber of your muscle and your tendon get the full benefit of that stretch and that exercise and that motion. So it's been about a minute, and that's that exercise. And the first exercise we did was this one, opening and closing your hand and then moving your arm along. The second exercise is this one of putting your hand down, stretching it down, and then bringing it up to the horizontal position. The third exercise is this one, down to the horizontal position. The next exercise, we're going to turn our hand over and bring it up. Back to a horizontal position, very, very slowly. Only for about a minute for each one. With this exercise, I find this one to be quite effective and quite challenging. You don't want to twist. You don't want to twist, you know, when you're bringing your hand up, you don't want to twist it either way. You don't want to twist it too much that way. You don't want to twist it this way. You want to keep it as directly horizontal as you can. And when you bring it up, you want that to be in a straight line with your arm and your elbow and your shoulder. And just probably even slower than I'm going. My biggest challenge is going slow. So if you can do it slowly, the slower the better. And it's okay if you can't bring your hand up very far, because this might just be the first time you're doing these, but as you do them more, you'll find that you become more flexible and more comfortable in your wrist. And then the next exercise is just from horizontal to down. And this one always feels really good to me because I can feel it stretching tendons inside my wrist there. You don't need to do these every day. You only need to do them once a day, every couple of days, maybe 2 or 3 times a week. And you don't want to do them too much, because it's likely that if you have wrist pain or forearm pain, that there's a bit of inflammation in your arm or your wrist or your hand from overuse of doing tiny little movements like writing or clicking a mouse. I personally get quite sore wrists from doing lots of massage and writing and using a mouse on my computer. I do all of those things actually. So that's the one arm. Now I'm going to do the other arm. And I'm going to do them with you so that in case you are doing these exercises with me, you can go through the whole video and just do them with me. I find that it's a bit easier to stay focused. We're basically just going to do all the same exercises with our left arm that we just did with the right arm. And then at the end of those, there's one more that I want to show you. And the one at the end is probably the most important one. So again, just go as slow as you can, so the tiny little muscles all around the edges of your joints and your fingers can get the full benefit of the exercise. This one has a lot to do with compression and blood flow. And as your compression of your left arm with your right forearm, and you stretch your hand open and close, you can feel your tendons through your wrist and your arm stretching in response to that movement in conjunction with compression. You can do it twice if you want. If your arms are really tight and you want to do it twice, do it twice. I was doing them twice when I first started. So that's the first one. This is the next one we're going to do. Same as the right arm. Just do them as slow as you can. And about 1 minute each for these ones. You can do them for 2 minutes. But slower the better, but probably no longer than 2 minutes. You don't want to overdo it. These are the kinds of exercises that are more effective if you just do them a little bit every couple of days. If you try to do this for 20 minutes on each exercise, you're going to lose the benefit because you could exacerbate the inflammation. And we're just stretching, strengthening the muscles and the tendons and making room inside that joint for the muscles and the tendons to move in their sheath comfortably. All of your tendons have a sheath over them, and you want your tendon to be able to slide in along inside the sheath comfortably, but when you have tendonitis or tenosynovitis, the sheath becomes raggedy and creates little raggedy rips inside of it, and they get caught on your tendons and it hurts. And this exercise works really well to help repair those damages that can get done, that you can incur damages to your wrist or overuse over the time. We all use our hands so much, we tend to forget that we can stretch our legs and we can stretch our arms and our neck and our back, but our hands tend to get overlooked, which is crazy because we use our hands more than anything these days. I'm probably doing this a bit too fast, so you just want to do it as slow as you possibly can. Really call on your patience here. Make these movements slowly. I've been doing these exercises for a few years now, occasionally, just not every day, like I said. But when I first started to do them, I would find my wrist becoming really tired. By the end of doing this whole course of exercises, I would just feel exhausted in my wrist and my hand just from doing these little tiny exercises. But now I've actually succeeded in repairing a lot of that damage through the use of these exercises. They work quite well. That's why I'm making this video, because I've experienced the benefits of these exercises. And you know, I was pretty skeptical at first. And these exercises, like I said, there's a couple more at the end that I'm going to show you. I've collected them from people over the years. There's been other masseuses. I'm a deep tissue massage therapist, so I've come into contact with lots of other massage therapists. There's been acupuncturists and physios and personal trainers, and they've all contributed to my experience with maintenance of your hands and your arms. This one I'm doing right now, I can really feel it in my shoulder and my arm. My left arm is quite tight at the moment, so I'm really feeling the benefit of this exercise, and I know that this is going to make me feel better. And right now, I'm getting real tired. Yeah, this arm is really tight. Now, you don't want to do what I just did. You know, you want to avoid doing a whole stretch. You just want to keep each stretch to the horizontal, either going up or going down. And gently opening and closing your hand really slowly will It'll help loosen up every little tiny muscle around the joints in your fingers. You don't want to squeeze your hand, you just want to open and close gently. So I'm up to the last exercise, which is pretty significant, and it requires the use of a little bit of oil. I'm going to use coconut oil because I happen to have some handy. It's extra virgin coconut oil, but you can use any kind of oil or balm, or it's definitely a lot easier if you use some kind of oil. You can do it without oil. Anyway, what you do is you go use your thumb, and you start at your thumb and you alternate, and you just alternate from each side of your elbow. Your thumb to elbow, thumb to the other side of your elbow, thumb to elbow, thumb to the other side of your elbow. And you do this about 20 times. I think I'm up to about 4 or 5. I'm going to go, that's 6, 6, 7, 7, 8, 8, 9, 9, 10. And each time you're just going back to your elbow there, to your from your thumb there to your elbow. If you've got a sore arm, this will be feeling really good. This one you can do every day. You can do this one every day. This one's going to really help. I find the other ones help a lot. Like they're all of them are priceless. You could take or leave any of them, but I strongly recommend doing all of them at least a couple of times a week, and doing this rub of your arms every day. Okay, now I'm going to do the other one. Like I said, it's definitely easier if you have a bit of oil on there, but you can use it without. You can do it without oil. And you're pulling. It's a pull one. It's a pull type of action. You don't put too much pressure on the downstroke. You're pulling from your thumb to your elbow. Yeah, my left arm is especially sore. Now, people have different sore spots in their body. If you sleep on your left shoulder a lot, then maybe your left side is going to be sore. I mean, I'm right-handed, but my left shoulder actually gets sore more often than my right. But your right shoulder or your right hand might be sore. I definitely get both hands getting sore if I haven't done any stretches or exercises, and if I haven't balanced my activities. If I'm using one hand more than the other all the time, then that hand is going to get sore, and then the other hand is going to get sore from being pulled from the tension. If my right shoulder is being used more than my left shoulder is going to start hurting because the tension on the right shoulder is going to be pulling across my spine unevenly. And there's a couple more, just a couple of easy stretches that you want to do if you have sore hands or wrists or arms. This one, just gently, if it's tight. You might not be as flexible in your wrist. I mean, there was a time when I could barely make that far because they were so tight. But this one, and this one, and this one. This one, do it gently. Just do this one real gently. Yeah. And that's some self-care for your wrist and your